The problem is you do see a lot of antisocial people succeed. Loneliness is as big a risk factor for ill health and death.
We live inside our heads.
You go cold turkey, you go into withdrawal.
There is a lot of value in the stuff that we struggle with.
Better Thinking, conversations with experts exploring all things psychology. Welcome back to Better Thinking. My name's Nesh Nikolic, and today I have the privilege of speaking with Lou Lasprugato, a licensed marriage and family therapist and internationally recognized peer-reviewed trainer in acceptance and commitment therapy. Lou served as the chair of the ACBS training committee from 2022 to 2025 and was elected into the ACBS Fellowship in 2025 for his contribution in ACT dissemination. With private practices in California and Virginia, Lou specializes in anxiety disorders, intimate partner relationships, and OCD-related concerns. A lifelong learner guided by Kaizen, continuous improvement that is, he emphasizes authenticity, psychological flexibility, and showing up fully as both a person and a clinician. Our conversation today focuses on using the therapeutic relationship as a vehicle for change in ACT through modeling, evoking, and reinforcing both helpful behaviors and insights, while also exploring the key qualities clinicians bring to their work, which is curiosity, authenticity, unconditional positive regard, compassion, and psychological flexibility. I really enjoyed speaking with Lou. He's a wealth of knowledge, and I'm excited to share this conversation with you. So let's jump right in. Lou, a big thank you for coming onto the program today. I'm excited to talk ACT. It's been a while since I've had an ACT therapist, trainer, come into the program, and a different take looking at the therapeutic relationship, something that I haven't covered before. So really looking forward to this conversation.
Awesome. I'm looking forward to it too, Nesh. Thank you for having me here.
How did you get into ACT? I usually start on, I know, for many there's different pathways, but what was it for you that got you into this space of leaning into ACT and finding out more, and obviously becoming a trainer?
Sure. I stumbled upon ACT in 2010. I was working as a clinician, psychotherapist in an intensive outpatient program at a large healthcare organization. And I've always had an interest in research and studies and kind of trying to stay up to date on the latest. And I was looking at a study on mindfulness-based approaches in psychotherapy and came upon acceptance and commitment therapy for the first time. And it, in the description in the article regarding this kind of mindfulness-based, values-directed approach, it piqued my interest because I had been a kind of a loosely practicing a Buddhist a meditation practitioner for a while at that point, and using a lot of mindfulness in my work with clients and in the classes I taught as well, skills-based classes. And then my graduate school training had a relatively strong emphasis on humanistic and existential approaches to therapy, and including meaning and purpose kind of as central to human fulfillment. So that was of great interest of mine as well. So when I saw this sort of kind of melting pot of mindfulness and values, that was of interest to me. And then I looked up ACT, came across the infamous hexaflex, and I appreciated the way these 6 processes were intersected in the service of developing psychological flexibility. So that's how I came upon ACT in 2010, and from there, I actually started using it for self-help purposes. So I started just immediately applying it to myself. Like, I kind of have this, this way of working as a therapist where if I'm going to ask my client to do something, I want to try it out for myself first, to have an idea as to what to expect, how it might land for them. So same thing with ACT. Like I wanted to try it on firsthand, and I like to say that anxiety has been a lifelong companion of mine. So and I was going through some anxious periods during that time. So I started applying ACT for my anxiety. I got the mindfulness and acceptance workbook for anxiety. I went to a training by the two authors. So this was George Eifert and John Forsyth. And I started applying ACT guided meditations by Russ Harris, by Jason Luoma, Jenna Lejeune, to myself on a daily basis. So I would listen to these meditations, practice these skills, and start applying them to my daily life. And so that was my start in ACT. And from there, I just any training that came my way where I could drive within 3 to 4 hours to get to, I would go. And so I started attending a lot of ACT workshops back then with Stephen Hayes and Robin Walzer and Kelly Wilson, and and gradually began integrating um, aspects of the model into my clinical work, individually with clients, into the groups I was running, both the skills-based groups and the talk process groups, and then developed my own ACT skills group. I think it was called ACT Flexibly for clients, for patients at this large healthcare institution. And that group became a training ground for other clinicians at the healthcare organization to come and observe and learn the model through being in this group with me as the facilitator. And that wasn't my intention at first, but I was the only one doing ACT at the time and in that organization. And so that word got around and people wanted to learn the model. And then I started giving short 1 hour lunch and learn presentations to the clinic. It was cool because it wasn't just appealing to psychotherapists, but the psychiatrists, the nurses began attending. And so I would give these monthly lunch and learns. I would also invite other guests to give lunch and learns on different topics. I'd learn from them. And that was kind of my start into the training side of ACT.
There's something so beautiful about the ACT model, the simplicity, the process based, the as you said, the infamous 6 processes, but those little lines that intersect between each of the processes is where the juice is. I think, and obviously understanding that it's all about psychological flexibility and the way that it resonates, the way that it kind of changes our lens. I think for practitioners, it's a lens that we start looking from, whether we call it a therapy, whether we call it a treatment, whether we call it a philosophy, training. It's really a lens or a perspective or a model from which we can kind of look from that obviously if it resonates for you, then great. But it's very powerful. And how did the interest of the model going into that therapeutic relationship come about? I haven't seen that before.
Yeah. So firstly, I just want to echo your use of the word lens or perspective, because any therapeutic model can function in that way, right? As a lens that we're looking through. And as I became immersed in ACT, I was beginning to do case conceptualizations to conceptualize the work of my clients through that lens. Watching for those 6 core processes, both the flexible and the inflexible side of those processes in the client's behaviors, and in the interactions that were occurring within the therapeutic relationship. And that became of great interest to me because that's when those processes are most alive, right? They're happening in the here and now, in the interpersonal context, and we can directly work with them in the here and now as they arise and to shape psychological flexibility going forward. So I just began I've always had an interest in the therapeutic relationship, going back once again to my graduate school training and humanistic and Carl Rogers in particular. Um, and then watching for those six processes as they were showing up in the relationship was fascinating to me because it was like a microcosm for what might be happening in other contexts of their life. And so we can use that microcosm of the therapeutic relationship to work on, shape, and then generalize psychological flexibility skills into other aspects of their life. Um, Not only that, but I see the relationship as the primary vehicle of change. So, at least in the context of psychotherapy, whether it's individual, and I also do a lot of couples work, it's in those relationships where those processes are naturally being modeled, evoked, and or reinforced, right? And so just to kind of break that down, so modeling, what is the client modeling in their behavior? What am I modeling as a clinician? So in other words, am I being emotionally open in this moment? Or am I kind of closed off and maybe avoidant of saying and doing hard things because I'm afraid of rupturing the relationship? Uh, am I getting hooked by my own thoughts of regarding maybe judgments of what's happening with the client? Or am I able to kind of step back, notice those as thoughts, and stay present with the client, connected to my own values as a clinician? How do I want to show up here? Right? What is it that I want to support in this person? So there's this modeling that happens as part of the whole shaping process that's taking place in the therapeutic relationship. Would you like me to go on to evoking and
Yes, please.
reinforcing?
Yep.
Okay. And then with evoking is most of what we do as a therapist or as a practitioner. Anytime we ask a question, anytime we invite the client to look at their situation or their thoughts and feelings in a particular way, anytime we reflect back something painful, something aversive, or something important or appetitive to them, like it's in those questions, those invitations, those reflections that we are evoking behavior. We're evoking new responses to stimuli, whether that's aversive, undesirable stimuli, or appetitive, more desirable stimuli with from the perspective of the client. So evoking is like much of what we do, I see as a clinician. And then there's the reinforcement part of shaping. And this is probably the most well-known part of shaping because this goes back to B.F. Skinner and shaping as differential reinforcement of desired behavior. So behavior that's moving in a desirable direction, as we reinforce that, that is shaping that behavior. So, and this process of reinforcement in my consultation work with clinicians, I find sometimes goes missing, where there isn't as much attention to the power of reinforcement. In other words, a clinician might be asking one question after another and not taking advantage of opportunities to reinforce psychological flexibility that's occurring in the moment, or even just by the client's report, their verbal report of what's happening in their daily life. So with reinforcement, I view that as possible in different forms. And one form, of course, is socially mediated reinforcement, where we might simply kind of, acknowledge or offer kind of kudos to a client for engaging in a particular behavior. Like, for example, wow, that's really cool that you were able to do that hard thing the other day with your daughter. I could see how important that was for you, and you made room for those uncomfortable feelings. That's awesome. Now, in that case, actually, as I look at that, even though there is this socially mediated part of the reinforcement in that it's coming from me and I'm kind of offering some praise, but I'm also drawing attention to um, the client's action and specifically what they were willing to do and the effect that that had. To me, at least, that's the kind of reinforcement that I want to lean on. This
Mm,
reinforcement that draws attention to the beneficial or workable effects of the client's own behavior, and for them to see that connection, to draw that functional relation between, I did this hard thing and it had this beneficial impact on me, or it was meaningful to me because of X, Y, and Z. So, in other words, when we draw attention to that, that can reinforce or make it more likely that the client will continue engaging in those behaviors, which is ideally what we want to see happen. Does that make sense?
absolutely, absolutely. And even in the example that you provided, depending on the timing of the session, and like even inquiring about how they feel themselves about having been able to sit in that discomfort, to tap into their values, and to advocate for their needs or whatever it might be. There's every angle under the sun available, but I'm in a big agreement. So I cannot recall right now. While you were talking, I was trying to find the guest that I had on, who really spoke at length about that missing link of uh, not reinforcing enough.
Hmm.
That the
Hmm.
reinforcement part is really valuable, because that's kind of where it embeds, and the part that we tend to reinforce least is we acknowledge someone's success, but his view was you need to really do a deep dive into
Hmm.
that success to embed and integrate those
Hmm.
those wins, and then obviously hopefully it generalizes more through doing so. So he was really advocating that, doing a real curious deep dive about how that came about, why it was different, the resources they had to pull forward to do so, what it felt like, what it was like afterwards, like just looking at every lens perspective that you could to try and bolster, enhance, reinforcement. He felt that was the missing link in well, there's certainly a lot of opportunities there, rather than leaving it on the table.
Yeah, well said. And I mean, I wholeheartedly agree with that. Like there's a lot of missing opportunities, and for us as clinicians to be able to watch for those opportunities and and use them to help the client build more of what they want in their life. So, for example, client says, I've been working on giving my son a hug every night before he goes to bed. Like, I've made that a pattern now, right? Now, instead of just saying, "Oh, great, that's great to hear," we can dig in, right?
Mm,
Like, what is that like for you when you give him that hug? You know, if I was there with you, what would I see happening? How does he receive that? How does he hug you back? What does that feel like to hold him in your arms? Um, you know, what do you think it means to him when he's going to bed at night after having just received that hug, right? What will a year from now, you're looking back and you're reflecting on these hugs. What will that mean to you, right? So these are all evocative questions, evoking, but they can also serve the function of reinforcement when the client increasingly connects the actions to their values. Does that
mm.
make sense?
Yeah, absolutely. Well, the evoking obviously is the invitation to for the client to I suppose consider that viewpoint. And in actual fact, their response is the reinforcer because we know it's obviously tied to their value, but they're doing all the
Right.
work. It's not us having to say, well done. Um, uh, it's them going out and reinforcing the purpose and the value and the meaning that comes from that. And you know, if the meaning is considered over a long period of time, and what does that then accumulate to? You know, what sort of environment does that bring for your son? It's more and more likely that pattern is continued, and obviously it's in line with their values. You know, it's not therapist driven, it's client driven, but it's powerful. It means that it's very likely to continue as opposed to just breezing over it and saying, "Oh, that's great that you're connecting with your son again."
Right. Exactly. There's a big difference there. And so when we dig in and help the client connect the actions to those values, like you said, it's in their responses that gives rise to intrinsic reinforcement, right? This is intrinsically meaningful or fulfilling to me.
Mm-hmm. What's interesting, I've been thinking about quite a bit lately, and we touched on it just before we started this conversation, is uh, the, the might be in the modeling side of the clinician, or I suppose how the clinician kind of sits with their own hexaflex of taking a deep dive into those areas. And I reference that from doing a number of podcasts recently in, metabolic psychiatry, and this gut microbiome approach of how that might be connected to your mental health, well-being, and so on. And that naturally does pose a question of microbiome, therefore what's your diet?
Mhm.
But I think for most clinicians to go down that path, we have learnt in our reinforcement in therapy that when we start talking about things like diet, clients are uncomfortable. They
Mhm.
don't really, at least my experience, they don't really want to go down that path. I'm not in the psychologist's room to talk about my diet. I'm here to talk
Mhm.
about and not the bio, but the psycho, and maybe
Mhm.
a bit of social part, but not the bio, right? And so you
Mhm.
learn very quickly to avoid that.
Mhm.
And
Mhm.
and that's what's so interesting about this, act within the therapeutic relationship. Like, what am I modeling by
Mhm.
being avoidant? And whether it's you know, avoidant of the reinforcement part, or avoidant of potentially areas that I think could be of value, or we could
Sure.
feed some viewpoints in that. So it's really fascinating to see um, uh, how how much of my practice I might be modeling something I'd like to change my modeling, through this, new lens that I'm seeing.
Sure. Yeah. I mean, right. What we're like, that's one level of learning. They're watching, they're observing us. And so what we're modeling is one level of their learning process. Um, and right, and I think avoidance can be a big issue for clinicians, whether it's regarding scope of practice, like you said, like the gut, we think there could be issues with diet, but we're afraid to talk about that because it's out of our scope. Or we sense that the client doesn't want to talk about that, so it's punished, and then we're not likely to bring it up again. Um, anytime, at least for me, that if there's something that I'm going to say that I'm afraid is going to cause a rupture to the therapeutic bond, right? So if we think of the therapeutic relationship as the kind of the larger context, and then within that context, we have what's called a therapeutic alliance or working alliance. And even though it's still up for debate as to exactly what constitutes a working alliance, the bond is one part of that. And the bond can be, seen as consisting of those Rogerian qualities of empathy and unconditional regard and authenticity. But there's also usually you want trust in the bond, and mutual understanding in the bond, and so on. And so if I'm going to say something where I'm afraid that it may rupture that bond, right? I'll notice that discomfort showing up in me and the kind of the a little bit of holding back at times. And in doing so, what is the cost of that? So by not saying that hard thing or asking that hard thing, what is the potential cost of that? So I try to ask myself that question because oftentimes the cost of that is greater than the potential risk. And especially if we've been working with the client for a little while, we've established rapport, there's there's some formation of a bond there, then ruptures, I think, can actually be a welcomed experience in some ways because this is what happens in our everyday lives. I don't know about you, but I haven't gone through a relationship with a family member, close friend, where there has not been a rupture at some point.
That's
And
odd, Lou, because all mine are smooth. All
right, right. So to be able to experience a rupture with someone we care about, with someone we otherwise trust, and to move through that experience together, I think is sometimes the heart of the work. And we can move through those experiences with psychological flexibility processes, with emotional openness, diffusion, with presence, with this observing self, with our values and taking action, right? So when those opportunities come up, when I'm about to say or do something hard that I think is functional for this particular client at this time, rather than holding back, I've been increasingly taking that chance. And and then inquiring afterwards, like, how did that land? Was there anything I did or said that was unsettling for you? Like to ask those questions. This is what I call functional feedback. So functional feedback is where I'm both watching the client's body language for after I intervene to see how they respond, but then also eliciting their verbal feedback as well. And then using that feedback to inform and shape what I do next. So there's kind of a mutual shaping process happening, if you will.
Hmm. I can already see it. I mean, it hasn't been long. It's been months rather than any length of time, but I can see this, thinking about going down that path of causing potential rupture to that therapeutic bond. My go-to at the moment is curiosity. Trying to really lean into curiosity in trying to be gentle and invoke their own curiosity or consideration, examination of that area. But I can see myself getting hooked up in my yearning to push it forward because my
Mm,
enthusiasm is so great at the moment, which has been my Achilles heel since day dot. Is I've got to keep a check on that, otherwise I will rupture that relationship, and so it's
mm,
really hard because I feel like there's that tension inside me of wanting more, and the process of ACT is in actual fact allowing a client's journey to unfold at their pace rather than my pace. Um,
good point.
but it's
Yeah.
fascinating to watch myself squirm with enthusiasm. Obviously, I don't think the client can necessarily see everything that's going inside, but there's plenty at the moment. I feel like this new exploration has evoked this. So this conversation is really helpful, and I love this functional feedback concept. I can probably integrate more of the actual asking questions afterwards because I think that even seeds the and models that you can check in about these things too. So I think there's something really valuable about
Mhm.
you know the feedback thing providing an opportunity for still more. Well, it's modeling and it's still again evoking and again it's reinforcing potentially.
Hmm. Yeah.
So aspects there.
Yeah. And Nesh, if I just touch upon a couple things you just said, you're tapping into both the qualities, which we haven't directly talked about yet, at least to some degree, of the ACT therapist stance. You mentioned curiosity being one of them, right? And also our own agendas, right? So, like, and that's why earlier when I said, if I'm going to say or do something hard, that I think is could be functionally indicated with this client at this time, that's key to me because I want to make sure that my own agenda or what I want or think the client should be doing is not calling the shots, right? Like you said, we want to respect the client where they're at, their pace. We may invite them to kind of push the envelope a little bit. I like to say, we all have our comfort zone, and then I am inviting clients to step outside the comfort zone into what we can call our growth edge, which is naturally going to be uncomfortable, but not to the point where it's overwhelming to them either, or not to the point where they're no longer in charge, where their self-agency and their self-efficacy is being undermined, which I don't want to do. So, so there's that piece about being aware of when our agenda might be operating and influencing our actions. And then the qualities, once again, curiosity. I love curiosity. If there, out of all the kind of the qualities of the ACT therapist stance, like that's one in my introductory trainings with participants, I emphasize quite a bit to see if we can remain curious about the client's experiences, their life, each new, every stream of behavior that's happening, and rather than kind of having these sort of and rather than anticipating or rigidly attaching to particular expectations or outcomes, can we remain curious and open to new data and allowing that data to inform our case conceptualization or our functional assessment? And that curiosity allows us also to suspend judgments. It allows us to, once again, not impose our own agenda, um, and to conduct an ongoing functional assessment, right? So that's curious about antecedents, behaviors, consequences, etc. So curiosity I view as key when it comes to the therapist stance. I also, once again, I think of those Rogerian or person-centered qualities of authenticity that ACT has adopted, also known as genuineness, where we're speaking from a place of kind of being a shared humanity, essentially speaking from a place of shared humanity
Yeah.
and allowing ourselves to be human first and foremost in that interaction, right? And then unconditional regard or respect, once again, for where the client's at, even though we may have differing values or differing perspectives or differing political beliefs, you know, can I still respect that this is their life? These are the conditions that have given rise to their beliefs, their behaviors, all right, and respect the client and where they're at. So we got that respect or unconditional regard. We have authenticity. We have curiosity, and then compassion. So, and compassion's interesting. So, compassion to me doesn't always mean like compassion is not sympathy, but rather like I am sensitive to human suffering,
Mm.
right? So I'm watching for and sensitive that we all suffer, right, as human beings. And I am motivated and committed to alleviate human suffering. So, in the words of Paul Gilbert from Compassion Focused Therapy, and I think that also was derived from Buddhism as well, but that commitment to alleviate suffering doesn't mean we're trying to eliminate pain or discomfort, which is the natural price of being human, but rather that extra layer of suffering that from an ACT perspective gets manifested from psychological inflexibility, from struggling against our own thoughts and feelings and experiences, from being hooked by a particular narrative or viewpoint or story, etc. So there's that, compassionate stance. And then lastly, flexibility. And flexible to me has two functions or meanings in this case. One, of course, is psychological flexibility. And we talked about that earlier. Like, am I modeling psychological flexibility? And the second, I think, is more straightforward, where it's, am I willing to be flexible as a therapist, as a clinician, to whatever's showing up from one moment to the next in the interaction within the therapeutic relationship? Meaning, like, let's say we're focusing on a little diffusion piece here, where we're inviting the client to notice certain thoughts showing up, and then, like, let's say a painful feeling arises. Are we flexible enough to shift to what might be most relevant or salient in that moment, to do a little bit of, acceptance-based work, as opposed to, we started with diffusion, we got to stay with that, right? So, like, it's being flexible, willing to adapt to those changing circumstances, like on the fly. Does that make sense?
Absolutely. Absolutely. If I can just touch on two of those points as well, or add to what you beautifully said. Uh, the compassion piece, the way I've understood it best in terms of that position of alleviating suffering, and you said it, so I'm just repeating it, but using a little bit slightly different language, which you'll probably be aware of, but uh, noticing the distinction between pain and suffering.
Yeah.
And
Right.
obviously this is that Buddhist model of, pain is unavoidable.
Yeah.
Suffering has, a potential volume on it that we can work on to
Right.
mitigate that. I've always looked at it that way, and that's really resonated, just because I think so much of our life has got many pains, and the acceptance model of that is liberating. Just
Hmm.
allowing for the world to be as it is, rather than, the reinforcement schedule of turning on an air conditioner tells me that I do have control over my temperature environment, when in actual
Right.
that will be challenged from time to time, and quite regularly. And this is how office wars on the AC can occur. But the second one is the flexibility, and you know that concept of psychological flexibility, the concept of, I like you raising it in the therapeutic relationship, as well as being flexible with the client, and noticing where that's always stood strong for me is looking at the evolutionary model of uh, you know clients come to us with a very narrow, generally speaking, a narrow set of behaviors. And so much of our work, in whether it's, through curiosity, authenticity, unconditional positive regard, the Rogerian sort of aspect and the like, is trying to evoke different lenses to and reinforcement schedules, and obviously some modeling, to increase the possibility of an expansion of one's behaviors that they've got available to them, to see which one's going to be most useful for those conditions and contexts. And I love that evolutionary model, because it then questions the next one, which is, if you've expanded all of these behaviors, you then get to do selection. So that's the selection part of evolution.
Hmm.
So which ones do I now select in future, now that I've got a greater repertoire or smorgasbord of behaviors? And then my
Hmm.
selection model comes in. And obviously, if I develop that, then I can start going into the maintenance phase. And that
Hmm.
it's connected with me. I'm not sure where my interest of evolutionary sort of psychology, or am I putting these two concepts together in a clumsy way? But when you speak about flexibility, that's what I hear, particularly around the therapeutic, relationship part of this, not just flexibility, psychological flexibility. It's also in the relationship. What am I doing? Where are my behaviors? The
Yes.
simplest example that I have is, do you start a session by saying, how have you been going? Which is this big open-ended, or do you start with, so last session we, finished up with X. Can we continue on with that? It's still an invitation, but you're moving it along. And there's an infinite number of ways, obviously, you can start a session. But even that's a small little glimpse or example of, maybe a different behavior from the therapist.
Yes, well said. I mean, you're reminding me of the EAM, the extended evolutionary meta model that Stephen Hayes and Stephen Hoffman put
Yes.
forward in recent years within ACT, and the evolutionary processes of variation, selection, and retention in context, right? And those processes, because they're evolutionary, they go both ways in the therapeutic relationship. So, to your point, like if you're asking at the beginning of a session, you said something like to the effect of like, oh, this is what we were talking about last session. Can we continue with that? We can take that a step further and say, right, so at the end of last session, there was an invitation, or sometimes I call it an action item, where you were going to do this thing that was aligned with their values. So there was a selection of that behavior, and then we want to look at how did that function for them? What effect did that have? And at the beginning of that following session, we can work towards retaining that behavior by reinforcing it and by exploring with the client how they can expand upon that behavior functionally, but through different forms in their everyday life. So, for example, I don't know, going back to the hugging my son example, like if that was like their homework assignment, or what I use the term action item, where I want to give my son a hug every day when he comes home from school, and we explore, how did that go? What was that like? Why was that meaningful to you? Is this something you want to continue doing? And if you were to build upon this, to expand upon this, what are other ways, what is this in the service of? What is it you're trying to demonstrate? And what are other ways of acting upon that value in through different behaviors and in different contexts, right? And there's that retention that's happening in different contexts, right? And variation. We're varying those behaviors. But the same thing as a clinician, we can ask ourselves, like, am I going into each session starting the same way, saying the same thing? Do I have my go-to exercises or questions that I use? Or am I willing to vary what I do, to change things up, to explore? And yeah, not all of them are going to land well. We can pay attention to the function, right? And select those that work with a given client at a given time, and then maybe retain them, if it seems to be effective for that person, right? So we can do that for ourselves as well. So I think those evolutionary processes are key, and they go both ways. And I view that as another important lens to take on, that coheres very well with the psychological flexibility model, but just offers a slightly different perspective, and one that historically goes way, way back. I mean, it's not just behavioral, right? This is biological too, right?
Yeah.
And sociocultural.
I'm chuckling and smiling to myself, Lou, while you're talking, because I'm reflecting on, and I've known this for such a long time, that, if I read an article, or I attend some training, or I do a podcast like this, I'm sure my clients must notice this Bambi style, therapist that shows up in the room that's trying to figure out this new language set, or is, clumsily, trying to be curious about something, hasn't put it together yet. But I've always justified it to myself of, obviously it's in the service of doing, better quality therapy, and providing a um, uh, a better outcome, or opportunity for my clients. But I've also sold it to myself to give myself that permission, so I'm not hooked. In the idea of uh, it doesn't need to come off perfectly, because if the intent is there, that authenticity, that genuineness, um, they will most likely still see that I'm batting in their corner. I'm still there for that reason, even if my language hasn't delivered it in the intended way. They might literally be n=1. Someone's got to be it. Uh, uh, and yeah, to be fair, n=10 is probably not that much better. Um, it probably is, but there's still that value of that authenticity and still being clinically appropriate. That's that important. It's not my agenda, but still trying to integrate some of those learnings. But I smile because I'm just thinking, I always envisage Bambi just trying to learn to walk. Can't, like young animals that can't put it together yet, but they're still doing
Sure.
it. They just can't do it well.
Yeah, but I appreciate the point you're making. And even, Bambi is, still has a certain presence, to her. There's a presence. And we're coming back to those qualities of the ACT therapist stance, which I view as first and foremost, like what we're kind of leading with. Because as you're pointing out, if you're embodying authenticity and respect and curiosity and compassion, then yeah, you can fumble your words and fumble the intervention. And, the client is likely, especially if there's some rapport there, going to have some grace, in response. So, yeah, those
You do
qualities,
it.
once again, I come back to over and over again.
How do you do it, Lou? And how do you ask your participants in your training to do this as well? Obviously, you deliver a training, and participants are taking notes. They're going through role plays and the like. They're developing skills, different approaches and the like. How do you encourage them to uh, to try and integrate some of those learnings into their practice, and maybe even on a personal level? How have you done so currently, in the past, etc.?
Sure. Yeah, I think what I often do is invite clinicians to temporarily strip away interventions, techniques, exercises, all of that, and simply focus on those qualities of, and I present these qualities of the ACT therapist stance. However, I also invite them to ask themselves, right, what values do they want to bring to the therapeutic encounter, to the therapeutic relationship? And oftentimes I'll hear something like, well, I want to be helpful, or, I want to be kind or empathic. I'll hear, oh, great. So for this next practice role play that you're going to do, how about focusing just on those qualities? So you're not trying to get anywhere, you're not trying to move anything, you're just showing up with those qualities, where everything you say and do is infused with those qualities, just as a means of grounding their approach in the therapist stance. Does that make sense?
Yeah, yeah.
So that's one exercise, one role play we often do in introductory ACT workshops. Um, I'm thinking I'll also have them do one-on-one dyadic exchanges with each other, but those are focused more on the psychological flexibility processes themselves. So for example, I have an exercise we do called a mindful dance, where two participants are taking turns simply sharing what they're noticing from one moment to the next, back and forth in this dance or this exchange, where what they share or their response is naturally influenced by whatever their partner just shared. And this is designed to facilitate interpersonal presence, right? So interpersonal presence and connection, and also this observing self, like kind of to notice you in this interaction, notice your partner's looking at you, that whole perspective taking piece as well. So the point is there's other exercises we do, these dyadic exercises to help to instill those psychological flexibility processes interpersonally. We do a similar one with emotional openness. I also use these in my couples interact with couples workshops because they're really cool exercises for partners, romantic partners to do as well. That can facilitate some interpersonal flexibility. We have one where each partner is asking their partner a values-based question to help them get in touch with their values and kind of like declaring their values in this interpersonal space. And just, each of them kind of making room for that experience, helping to draw out the qualities of those values of vitality, of even vulnerability, of interest, passion. And so those are the kinds of exercises we do. So once again, we have this kind of more as far as the therapeutic relationship, embodying the qualities of the ACT therapist stance while removing all interventions. And then we have these dyadic exercises where they are practicing with the psychological flexibility processes interpersonally. Does that make sense?
Absolutely. I really, really like that practice and approach of showing up as a therapist, as a mindful, present therapist, thinking about the qualities, the characteristics you want to show up with and removing interventions, strategies, skills, etc. Because I feel that gets in the way so much. And in actual fact, might have second order or third order consequences of saying there's something wrong with what you're experiencing, and we need a strategy to remove that.
Right. Well said.
I think that second order, third order consideration is so important for that therapeutic alliance, that we're considering, what might be the unintended message that could be taken out of this, and that's why ACT has always resonated so well. That humanistic understanding that you're human and your emotions, your thoughts, your feelings, are a reaction to the consequence. Sorry, to the context that you're in.
Mm-hmm.
They're not considered an abnormal in the lens of ACT.
Right.
And I think that in and of itself is a beautiful stance, standing alongside you without judgment, still holding a place of compassion and understanding, but without going out and saying there's something wrong about you. Something is occurring for you, inside you, but we don't want to be the judger of that. We can still assist in how you might try and live with those conditions, because sometimes they're unavoidable to as well, like grief. There's many griefs, that not just the loss of a loved one. There's many griefs, loss of dream that someone held, and so on and so forth. But I love what you said about the therapist stance, removing interventions. That's just so beautiful. Was so well said. Thank you.
Yeah, and you're also highlighting for me, I mean, I don't consider this necessarily to be a quality, but it is still part of the stance, which is being contextualistic, right? So like, recognizing that there's a context that gives rise to all of our behaviors. And I think ACT lends itself really well to that, there's nothing inherently wrong with you, normalizing human experiences because of the emphasis on context, the situational context of the person's life. Like, of course, you'd be thinking or feeling this given what just happened. The historical context of their life, of course, you'd be struggling or feel threatened by this given that past experience. And then the evolutionary context, right? We're wired to survive, right? This is what our minds tend to do, right? So, and then we can bring in the sociocultural context too. But looking at it through those lenses allows us to naturally, very and organically take a normalizing approach, a non-pathologizing approach, because we're always being sensitive to, we're context sensitive, right? And I think that is one of the dangers of the hexaflex, which is what first drew me to ACT,
Yes.
because you see these six processes and you think that's the whole ACT model, and it's not, unfortunately. I mean, and well, no, fortunately, it's not the whole ACT model. So it's important to look under the hood there and to see that there's a lot more. In fact, in my introductory workshops, I don't go anywhere near the hexaflex in the early stages. So for a 2-day workshop, the first hour and a half to 2 hours is all on the foundations of ACT, functional contextualism and relational frame theory, and that evolutionary lens as well. That's the whole focus for the first hour and a half to 2 hours. I want to make sure clinicians realize that there's these underpinnings that inform everything we do, and that ACT is not a set of techniques based upon the hexaflex. So I think that's important too.
It's such a challenge, us being human, we just love categories. We love lists, and those six core processes, we love them. It's like I've got somewhere to point to. I know what I'm doing. It gives me a sense of guidance and accomplishment. And it does all of that, to be fair.
Yeah, it does. It
We
does.
need a bit more nuance and consideration of, in actual fact, I do supervision with my clinical staff, and obviously have trained myself for a period. So much of this is when you start to pull it apart and unpackage it and just consider it. And as an observer, from a mindful observer, every question, every moment that we're curious, we're evoking numerous processes at the same time. You can't do one independent of the other. And hence why I think, the understanding of it's a mindfulness
Hmm.
based approach, that mindfulness has to be present, basically
Hmm.
all the time, because you can't go
Hmm.
out and access those other
Hmm.
parts, which is not that's not revolutionary at all. This is why, anyone that's been with a distressed client or a distressed family member or distressed themselves, emotional regulation, is kind of needed to get another perspective. Police
Hmm.
officers know this. If you just
Hmm.
speak with someone for a period of time, they might sort of settle down and they become a very different human being within 5
Yes.
minutes. um,
Right. Yep.
but yeah, it's hard to train it, because we do have to talk about it, but we
Right.
as human beings love saying, "Oh, I'm doing diffusion." Uh,
Sure.
such
Yeah.
a quick catch, right?
Yeah, I mean, to your point, once again, the hexaflex is what drew me to ACT. It has that appeal, right? So, and I don't want to throw the baby out with the bathwater, right? Like I think it has a lot of utility. I like to think I offer kind of sort of these three, what's the word I want to look for here? It goes beyond viewpoints, but when it comes to ACT training, I want to make sure that A, they're getting the foundations to some degree. B, they're getting some classic exercises, some, quick interventions that they can use and feel like, ooh, I got something I can use right out of the gate here, right? And I use those in the beginning. I still use them occasionally with some clients
Yeah.
today, yeah, depending upon the context, and they could be really useful. So I do offer that as well. And then there's this more kind of organic, process-based approach that occurs within the therapeutic relationship. So throughout my longer training events, they get exposed to all three and they get practice with all three, with functional analysis, with this more organic process base where we're like just infusing flexibility along the way, saying something like, "Oh, did you notice how you turned away just now when I said that, right?" Or, "Ah, this seems like this is something really important to you. Can we dig into that? What is that about?" As opposed to going into, let's say, a classic values-based question of some kind. But we can do that too. So I offer all three, and hopefully, and then clinicians can find their own way from there. Like it's like, what is appealing to me? What do I want to, dig in deeper with? And then I offer them some suggestions on how they might do that.
Look, there's so much value in, I think what you also said early on in trying to capture every training opportunity within 3 to 4 hours of driving. I did something very, very similar, and even this conversation allows me to pick up on some of your language. It goes out and stimulates all of that again, and hence why these conversations are important. There isn't necessarily right nor wrong. This is our own therapeutic journey as well, and that's why I really like this idea of the therapeutic relationship has its own journey as well. That I've never looked at that lens before. So that's really interesting. If you don't mind, if I can switch gears just a little bit,
Sure.
because I am interested. You raised doing work just in an exercise, but wouldn't mind finding out a little bit more about ACT in relationship work. So with couples.
Sure.
I personally do a Gottman model
Yep.
informed approach. It's something that I still try and actify it as much as I humanly can. And I've trained a little bit within the sort of EFT model, but I haven't seen an ACT place. Can you talk a little bit about ACT within the couples space? I know
Sure.
it's a bit of a segment, but I'd love to hear about it because that's a space that I'd love to learn more about.
Well, I mean, the therapeutic relationship is an interpersonal relationship. So I view this as a kind of a, nice transition here, right? Nice segue. We're looking at in this case, romantic or relationships between intimate partners, right? Um, so this has become a passion of mine in the last few years and a specialization. And I started offering what I call interact with couples workshops about 3 years ago. And interestingly, my schedule for this year for training is filling up more with that than ACT for individuals. So I think there's a general and genuine interest globally around applying ACT for couples because, to your point, it's not talked about very often. It hasn't been studied as much with that population. There's a handful of studies, including randomized controlled trials, that have come out of Iran in particular and some other countries on using ACT for couples. And most of those studies have been done in groups so they have couples, but it's in a group format. So it's hard to tell for sure, how that would generalize to working with couples within, just that relationship and not being in a group. With that said, I mean, just generally speaking, ACT in that setting, in that context, excuse me, has had comparable effectiveness with CBT for couples, IBCT, integrative behavioral couple therapy, and to a little lesser degree with EFT. So it's been compared to emotionally focused therapy, and I think two studies, if I remember correctly, where both were showing improvement in avoidant attachment-based repertoires. So in other words, both EFT and ACT were helping to reduce avoidance in the relationship. but EFT had more improvement in secure attachment repertoires, which is not surprising because that's what the EFT model is based upon. So, that when I saw that, I thought to myself, I was already starting to apply ACT interpersonally with couples and extending those processes interpersonally. Um, but I thought, there may be something missing here. And I was so it was like when Stephen Hayes began talking about and more formally introducing yearnings into the ACT model in the last 5 years. So it was about 5 years ago, I think, really in his A Liberated Mind book. So probably 2019. So maybe actually like 7 years ago now, where it was more formally introduced. I thought that was like that to me was like the missing component of the ACT model, especially when applied to couples, because we all come into relationships with yearnings. We long to feel connected. We long to be emotionally validated. We long to be understood. We long for shared meaning to carve out a life that matters to two of us, to have shared experiences around that. We long for security or secure attachment. So there's these natural yearnings that we come into romantic relationships with, and those yearnings are drivers of human behavior. They will drive a lot of the behaviors we see between couples, for better and for worse. Um, and when those yearnings are not being met, or if they're being, blocked in some way, uh, issues can arise there. Also, there can be yearnings in competition with each other. So, for example, one partner is yearning for let's say, more shared meaning together, to have more meaningful connection activities together. And the other partner is looking to carve out, more of a meaningful life on their own, like in their career, let's say. Or, one partner might want more one-on-one connection. The other partner is looking for more belonging, to be a part of a larger group or community. So sometimes these yearnings can compete for attention with each other. There's vulnerabilities that sit on the other side of these yearnings. So, for example, if I'm longing for connection, there's a risk of rejection. When I make that bid for connection, there's a risk of rejection. If I'm yearning for like a secure attachment, there's a risk of betrayal, and so on. So those vulnerabilities, uh, if when they get poked at or when they get threatened, that will often elicit these threat-based responses in couples where they feel inclined to either attack, withdraw, right, or shut down, right? To attack, attack, defend, or withdraw. Attack, defend, or withdraw. So they either go on the attack where they're criticizing their partner, defending themselves and justifying their own behaviors, or withdrawing because this is too painful and uncomfortable and I'm trying to avoid conflict, right? So those threat-based responses get elicited when the vulnerabilities on the other side of those yearnings are threatened, are poked at. So there's that whole piece, plus extending the psychological flexibility processes interpersonally. So emotional openness is not just open to my feelings, it's open to your feelings. Can I genuinely make space for whatever you're feeling right now in this moment, just as it is, without trying to fix it or change it or dismiss it in any way? Right? Um, for self as context, I like to think of us as context. Am I not just, instead of this me versus you dynamic, am I aware of us, our relationship, and how my behaviors might be impacting the relationship? So aware of us as context, and so on. So we can take, same thing with present moment, being present interpersonally, diffusion. Can I unhook from my own thoughts here and make room for your thoughts? Like listening to your thoughts doesn't mean agreeing with them, but can you have your own perspective and I have mine? Even though there's some disagreement here, that's going to require me to be a bit diffused from my own viewpoint. Um, Values, once again, there's the values of how I want to show up in the relationship, and also shared values. What do we want our relationship to stand for? What do we want to move towards together over time? And then finally, committed action, right? So engaging those values, both the personal values, the relationship values, in action, building patterns of behavior over time, and so on. Does that make sense? That was
Yeah.
a lot.
Look, it's beautiful to hear you speak in that way because my mind is just, as we do, we're trying to fit in new material into trying to make it work in current material. And so every time you're saying something, um, I'm going back to the Gottman model or method, and I'm putting it all together. Going, oh
Sure.
yeah, that's that part, that's that part, that's that part. So I suppose that's just how my brain works. But it's
Sure.
uh yeah, I
Yeah, these
all of
models are going to have some overlap. Sorry
yeah.
to cut you
I
off, but
think
yeah,
that's the beauty of it. I think they overlap more than they differentiate, but uh, there is such importance about the intent, which I think is that second order, third order stuff, and that's why I like the ACT model applied to life. And when we talk about it, from a relationship point of view, it's something that I haven't considered enough. But understanding that intent, that is obviously so much in these relationships. You're bringing two individuals who are naturally going to be caught up in themselves, because as you say, every longing, every time we
Mhm.
have a yearning, a longing for something, there is
Mhm.
a vulnerability there, or a
Right.
an anxiety, a worry, a concern, or something, a threat.
Sure.
Every
Yes.
time we have something that we want, there's a threat to
Right.
losing that. Um,
Right.
and everyone comes in with a lot of things that they want, because that,
Yep.
and it's beautiful within relationships. But even little things like, one one of the parties just wanting to, I don't know, it might be continue one of their activities that they did prior to entering the relationship can be a threat
Mhm.
because it's an individual activity. And if someone has a longing for, connection and being together, even though they might spend so much time together, there's still a threat of, losing you if you're going away. And so
Right.
very normal activity, I don't know, going to the gym could cause them angst, worry, concern, because there's a threat of you might meet someone at the gym, and you look
Sure.
wonderful. Of course, others are going to want to, approach you, and they always do so in the worst of ways. It's scary
Mhm.
stuff, and it does happen too. This is a
Sure,
reality
it
thing as
does.
well.
Right. Yeah, it
Just being
does.
able to
It
observe
does.
from that lens and putting that language on is has really sort of fired up my want to learn more to put this ACT framework across it.
Mhm.
You do that training? Do you do that online? Is this usually face to face? Is it more for the couples themselves? Is it for the clinicians? Maybe you can tell us more about your work. How can people find out more, the training that you offer, the formats and the like?
Sure. So the trainings have all been for clinicians so far. They're mostly virtual online, live online. They're hosted by different groups or organizations. I have like four or five interact with couples trainings coming up for 2026, of varying lengths. So from 2 hours, so there's a 2 hour introductory training which focuses on yearnings and interpersonal flexibility, which is in May, May 19th, I believe, and that one is hosted by Hudson Valley Professional Development. Let me take a look here. Yeah. And all of these trainings can be found on my website, which is loulasprugato.com. In fact, I just revised or remade the website. So there's a section for events on there. There's a page for events. And there's also a page on training and how to get a hold of me for training. So yeah, there's a 2 hour, well, we're debating if we're going to do 12 or 16 hours with Praxis continuing education. So I've done that training with them twice already. This will be the third, and that'll be September, October. We're just right now finalizing the duration of it. If it'll be 12 hours, which was what we've done in the past, or if we want to extend it to 14 or 16 hours, we'll see. And then I'm doing a version of it, an 8 hour version of it with Contextual Consulting. It's Joe Oliver's organization in the UK, and that's in December on two Thursdays. Those are the ones that are available to the public, and then I have a couple I'm doing privately for other countries or organizations. And like I said, those can all be found on the events page. But yeah, we focus on what we've talked about here so far. We focus on a big focus is on patterns of interaction. So watching patterns of interaction occurring between partners and doing an ongoing functional assessment regarding those patterns to actually, to your point earlier, intent. There's a lot of focus on intent and effect, and the intent and effect of each partner's behaviors. Oftentimes a partner will sort of defend their intention, like, I didn't intend to hurt you, that wasn't in my intention, and they lose sight of the effect that's having on the partner, and vice versa, where we're only focused on the effect and we're disregarding the intent. So part of the work is in bringing attention and kind of making room for both and seeing them as both valid, and neither of them is necessarily the problem in and of itself. So a lot of focus on the patterns of interaction, on case conceptualization, bringing in a sociocultural lens, and yearnings, flexibility, threat-based responses, all of that into the case conceptualization. We also do some work on shaping, not just psychological flexibility, but shaping what I see are these four foundational skills of observing, describing, tracking, and choosing. So observing, describing, tracking, and choosing. Those four skills, they're inside the hexaflex processes, but they're kind of simplified here. And so a big part of the early work with couples is just as both as the clinician, us observing, describing, tracking, and choosing, but helping partners observe their own interactions, describe what's happening for them, describe the underlying feelings that are showing up, tracking the functional relations. When my partner does this, I tend to pull away, and this is the result that it has. And then choosing how they want to show up in these interactions, how they want to respond when things are tough, after that initial threat response passes, how do they want to kind of come back to the interaction? So that's a big part of the work, the interact model, and the training.
Look, I'm going to go out on a limb, but I don't think it's a very, very large limb, because I haven't necessarily, or I haven't done any of your training, but I can comfortably say to listeners that they would get an immense amount of value in attending your training, because I can just hear it in your language. I can hear it in your approach. The simplicity of, boiling this down to the processes that we can use, and think about a lens that we can kind of adopt. I think you've got such lovely delivery and language. I feel, revitalized in this conversation, excited again, some language that I've picked up on, and stimulating a new observer in my sessions as well, that looks at the therapeutic relationship, the alliance that's occurring. I can very comfortably go out on a limb, which really isn't a limb, I don't think. But for those interested, go to loulasprigato.com. And if you're looking for the training, put in /training, but it's on there as well. Anything you would like to wrap up on, Lou, before we finish up?
The last thing I'll mention, only because you happen to mention the alliance again, is just that, earlier we talked about the qualities of the, ACT therapist, the stance we take. What I'm realizing more and more these days is that, rather than even attaching ourselves to to these, certain qualities, like for each client, each person we serve, different qualities might be needed to build a working alliance, to build trust and rapport. With one client that may be humor or even irreverence. For someone else that might be more sensitivity or compassion. So I'm trying to be more mindful of that, like functionally, what qualities are going to be most useful for this particular context, as opposed to, just kind of presupposing, a certain set of qualities that we take in with us. Within we can have those qualities available, but let's be selective with what we use depending upon the context, right? To come back to that evolutionary perspective too.
So that's such an important part of how we show up as clinicians, that we can still maintain our value sets and our character and our belief systems and the like as who we are, while also being flexible for the therapeutic alliance and relationship. And the common thing is what does your character look like in the room? And that should, at least in my view, look different. With that
Right.
one client, if they walked in on another client's session, they might go, this isn't necessarily the therapist that I know. There are aspects in this room that are different, whether it's language, whether it's about the use of their humor or what they're leaning on. Sometimes they might need to be more professional in the language, sometimes more brash, sometimes more friend-like in certain moments.
Hmm.
We've got to be a chameleon to meet the client needs, and that can still come from a place of authenticity. But that's how we do all of our relationships. Our work relationships very different to our
Yeah.
social relationships that then they do again with our partners and they do again with our parents.
Right.
So
Yeah.
we're
Well,
different beings.
Yeah, well said, Nesh. I would say authenticity plus context sensitivity,
Yeah.
right? So there's an authentic you showing up in all these different roles or interactions. It's the same thing with couples. How I interact with one couple might be very different in how I interact with another couple. In fact, the very first blog I wrote, called "Setting the Tone in ACT," it focuses on exactly that. How, if there's one thing that's I don't remember how I worded it, but like, you know, how I show up or how you might see me, while the ACT processes are the same, how it looks from one clinical context to the next will vary greatly
Mm.
sometimes.
That's why it's so hard growing up until you kind of figure it out. When you're hosting a party, it's so hard bringing different groups of friends together because you're different with those groups and you don't know who to be at that time. So you feel like you're, awkward. Plus, you feel like you're neglecting each of the groups. It's really hard to reconcile that as a young person because obviously at that point you're being vulnerable. You're being found out. Will either of the groups like me now, versus still being, true to oneself and obviously diffusing from those thoughts, so on and so forth. But it's, these examples just keep showing up in all of life, and that's what I love about this. But we are contextually going to be sensitive, and I think that's an important part to this conversation. So thank you for finishing up on that. I think that's a really key point to this conversation as well. Lou, thank you very much for the time, your expertise, the knowledge that you bring forward, the work that you do, and also for being part of the ACT community. I'm glad you're one of those presenters that do training, because there's a wealth of knowledge there for hopefully people to jump on and get involved in, and become greater clinicians. And I think the beautiful part about ACT is. I'm not going to use better, because that's judgmental, but to be um, people that are connected and mindful and considered around how they would like to show up and what they would like to bring, whether it's on a personal sense, because I think we all benefit from that, and that's the beautiful part of the self-help part of it, that most of us just do that immediately, but then being able to offer that to others. So thank you for all your work.
Yeah, man, thank you for having me here. This was really cool. And yeah, I love doing what I do.